COVID-19 is a highly contagious coronavirus closely related to the SARS and MERS viruses. COVID-19 appears to be more easily transmitted than either SARS or MERS, but less severe. Illnesses associated with COVID range from mild to severe, including respiratory issues resulting in death. The virus seems to have a greater effect on people over the age of 60 and people with underlying health conditions like heart disease, lung disease, or diabetes. Time from exposure to onset of symptoms is generally between 3 and 14 days. Health officials believe the virus is spread via droplets in the air or on surfaces. Patients with confirmed cases report mild to severe respiratory illness with symptoms such as fever, cough, and shortness of breath. The virus may cause pneumonia in some severe cases. If you have been exposed to someone with the virus or who has returned from an area with known infections, implement a self-quarantine for 14 days. If no symptoms develop after 14 days, you may return to your normal routine. You should follow your company's policy in the event you expect to have come in contact with the virus, which may include various precautions as instructed by your healthcare provider and/or employer. If you develop symptoms, alert your healthcare provider immediately. Do not travel to a physician's office, clinic, or emergency room without calling a local healthcare professional first. Be prepared to discuss your symptoms, any recent travel, and any exposure to someone with the virus. The healthcare professional will direct you to the proper facilities that can test for the virus. Your healthcare provider can determine if your signs and symptoms are explained by other causes, or if there is reason to suspect you may have the virus. If laboratory testing is appropriate, your healthcare provider will work with health officials in your state to collect and test any clinical specimens for diagnosis. Typically, a sample is taken using a nasal swab. The best practice is to avoid being infected in the first place. So, how can I protect myself? Wash your hands with soap for at least 20 seconds. Yes, 20 seconds. Dry your hands with a disposable towel. Use a clean towel to open the bathroom door to avoid touching the handle with your clean hands. If soap and water facilities are not available, disinfect your hands using a sanitizer with a greater than 60% alcohol content. Practice respiratory etiquette at all times. Cough or sneeze into a disposable tissue and discard. If no tissue is available, sneeze or cough into your elbow. Remember, any virus passed on to your clothing may live for a week or more. Wash your hands as soon as feasible or sanitize your hands. Avoid touching your face, especially your eyes, nose, and mouth, unless your hands are freshly washed. Avoid shaking hands. Use an elbow bump, small wave, or foot tap as a greeting instead. Use your knuckle or elbow to touch light switches, elevator buttons, etc. Use sanitizing wipes to clean off shopping carts and baskets. Use credit cards, not cash, to make purchases to avoid handling money. Open doors with your closed fist, forearm, or hip. Avoid grasping door handles unless there is no other way to open the door. Especially important on bathroom and public doors. Keep a bottle of sanitizer available at each of your home's entrances and in your car for use after touching potentially contaminated objects, such as a gas pump, when you can't immediately wash your hands. As we fly on airplanes, consider bringing disinfectant wipes for travel both to and from a destination, to clean the seat space and related equipment, seat tray and lock, seat belt, air vent, armrest, etc. Also, the aisle seats are said to be the ones where there is most likely transfer of virus, given the aisle traffic and passage by of row seatmates. Consider turning on air vents, but positioning them in a manner that directs airflow toward other passengers who may be coughing and sneezing or exhibiting signs of a flu. Remember, this virus appears to spread in droplets by coughing and sneezing. The surfaces where these droplets land may be infectious for a week unless cleaned and disinfected. Respiratory etiquette and hand hygiene are the best defenses. If you have not been vaccinated for seasonal flu, it is not too late. To keep the healthcare system from dealing with seasonal flu issues, make sure to get a vaccination. The flu vaccine is not effective for COVID-19, but it may keep you from needing medical care for a preventable disease. If you have a family member over the age of 60 or with underlying medical conditions, what should they do to protect themselves? Beyond the previous advice, they should ensure that they have a sufficient supply of prescription and over-the-counter medications for their conditions. Avoid sick people, even grandchildren. Restrict their travels and avoid large gatherings. They should also immediately contact their healthcare provider if they develop any symptoms. Remember, there are two critical things to help minimize your chance of contracting any virus. 1. Wash your hands often and thoroughly for 20 seconds and avoid touching your face. 2. Practice respiratory etiquette. More information can be obtained from the CDC. Stay educated, stay safe.